everybody. This is Dr. Paul Firnhaber. It's Wednesday and time for another edition of 10 Minutes of Truth. So today I have an article out of a journal called Risk Management in Healthcare Policy. This is January 7th, 2021. So it's a little bit, it's 4 years old. The article is called Effects of Vitamin D on COVID-19 Infection and Prognosis, a Systemic Review. So vitamin D, or hypovitaminosis D, which is low vitamin D, is associated with cardiovascular disease, diabetes, type 2, metabolic syndrome, cancer, and increased death rates. Advanced age and high body fat mass leads to an increased risk of deficiency of vitamin D. Depression and decreased cognitive function are also associated with vitamin D deficiency. In fact, just with a deficiency, a mild deficiency can cause weakness, aches, and body pain in general, which is interesting. Because what do most people take for weakness, aches, and pain in general? They take things like Tylenol, which lowers testosterone and causes your liver to be toxic and causes problems in the body. So, if you're having, the constant aching in the joints, you might want to get your vitamin D checked. Vitamin D has a particular role against enveloped viruses and direct antiviral effects. So the COVID virus was considered an enveloped virus. Vitamin D status is related to risks of influenza and respiratory tract infections. So if you're having chronic respiratory tract infections, you might want to get your vitamin D checked. Vitamin D deficiency predisposes ones to infections of a viral respiratory tract and mycobacterial infections, and thus vitamin D can play a role in the development and treatment of asthma. SARS, or serious acute respiratory syndrome, which was, COVID-19, is a cause of death, and as a consequence of exacerbated inflammatory reaction followed by uncontrolled oxidative stress and a lung-level inflammatory reaction. So vitamin D is an option to tackle this problem, considering that it can balance and control the immune system. It also is good for oxidative stress, especially against COVID-19. On survival, now, this is the next part of this article is they're going to cite different studies. So one study showed on survival analysis, extremely vitamin D deficient patients had a 50% chance of death after 10 days of hospitalization, where those with sufficient vitamin D had a 5% risk of death. A randomized pilot study that assessed the effect of vitamin D treatment and the best available therapy versus best available therapy on an intensive care unit admission. And they looked at mortality among these patients. It showed that high doses of vitamin D plus the best available therapy and the main significantly reduced the need for ICU treatment of patients requiring hospitalization due to proven COVID-19. So if they included vitamin D, it really reduced the need to be in the intensive care unit. Now there's an interesting study then, there's two groups of patients. Of 50 people treated with vitamin D, only one required admission to the ICU, while 26 of the untreated patients, which would be in the other group, 13 required admission. So that was 50%. So we're looking at, a real significant difference if you're taking vitamin D and you get COVID or you get things like influenza. Hospitalization of COVID-19 patients was associated with vitamin D deficiency by 77%. COVID-19 disease severity was associated with vitamin D deficiency by 95%. Mortality is significantly more common among severely vitamin D deficient patients. Treating serious vitamin D deficiency reduces the risk of high CRP levels. So CRP is a marker, a blood marker of inflammation. So treating people with high CRP reduces their level of inflammation. Vitamin D can adequately modulate and regulate the immune and oxidative response to infection with COVID-19. So your vitamin D status is really important. It's an easy blood test to do. It's a non-fasting blood test. And I do it with all my comprehensive blood panels get vitamin D included with that panel. There's one other article that I wanted to just mention real quick. This is an article out of the journal Nutrients. It's November of 2020. And the name of this article is Vitamin D Insufficiency May Account for Almost 9 of 10 COVID-19 Deaths. In this article, it said in a specific study, they found that 87% of COVID-19 deaths may be statistically attributed to vitamin D deficiency and could potentially be avoided by eliminating vitamin D deficiency. So we really don't have to say much more about this. Vitamin D is an incredibly important vitamin. It acts more like a hormone in the body, and if you look at the structure, it looks like a hormone. You know, you compare it to things like testosterone, estrogen, pregnenolone. Vitamin D looks very similar to those hormones. So if you think you might be vitamin D deficient, you ought to get it checked at least, get a blood test and find out, and then start taking a good quality vitamin D, and then get your vitamin D rechecked in about 3 months and see where you're at. It might save your life, might help you, might keep you from getting COVID, might keep you from getting the flu or other viral issues. And if you do get those issues and your vitamin D is sufficient, it could keep it from getting a lot worse or having you go in the hospital, the intensive care unit, and adequate levels of vitamin D in the body can get you over those things much faster. So get your vitamin D levels checked. It's really important that you have adequate levels. And I would say adequate levels are between 40 to 70, 40 to 80, right around in there, 40. That range is really a good range. So if you want to come here and get it checked, we can certainly do it. This is Dr. Paul Firnhaber at Lincoln Disc and Nutrition here in Lincoln, Nebraska, and our phone number is 402-488-2220. And I would urge you just to call our office today if you think you might be low in vitamin D, or if you're getting the influenza a lot or other infections, because you may have that deficiency, and we'd love to be able to help you out. So this is all I have for today for this particular 10 Minutes Truth. So we'll see you next week with another edition. See you then.